change the world? What does it take to touch a life?
Today, though, as you sit here, what are you fighting for? When you came into SSM, for some of you a couple months ago, for some of you 40 years ago, back then you knew what you were fighting for. Remember that? Is it still clear? Professionally, if you know what you're fighting for, I promise you, you will make a profound impact on the lives of others.
I'd like to share with you a page taken from a ledger from one of our SSM hospitals from back in 1893. As you can see, the ledger records the same kind of information that we keep in our hospitals today. The first column is hard to see, but it shows the date that the service was provided. It's 1893. The second column shows on the first line the physician. Then you have the third column, which shows the patient disposition, and they were either back then well, or they died, or they improved. And the fourth column shows how the patient's financial responsibility was met. And I find it interesting that the first line here shows that the patient paid $5, which is what we've all been asked to think about today, what we would do with $5 if we found it. The next line shows an indication of what we would call today charity care. And what they called back then were patients were our dear Lord's patients.
Do whatever you find in me.
We had lost our way, we had lost our focus. And we needed to focus on the relationship that we have with our patients.
Be surprised to see God works through harmony.
Successful long-term organizations are ones that strive to continually reinvent themselves based on the changing needs of their communities and the patients they serve. To do that, some time ago we set out to redefine our organization in order to try and take advantage of all the capabilities and resources across SSM, blending together all of the capabilities at each of our 6 hospitals, weaving them together in order to try and make the most of those talents and resources to build truly distinctive services. Well, first, it's possible to build clinical service lines that, again, combine all that technology, those people, those talents, in order to provide both exceptional care and help us position SSM for long-term strength and vitality. We now have 10 service lines operating across the network, again, bringing together all those capabilities in a coordinated plan for the future.
In 2008, we cared for nearly 2 million people in our hospitals, physician offices, rehabilitation centers, and outpatient facilities. Think about that, 2 million visits. Annually, we serve over 6 million meals on our way to being McDonald's.
In 2008, SSM in St. Louis served 33,787 Our Dear Lord patients. We gave $82,188,000 in charity care.
Bottom line is we're better together.
And to be surprised to see. Do what else.
Relationship-based care is very consistent with our values, compassion and respect. Compassion, that basic human impulse that has affected history and culture and human interaction for thousands of years. It's evidenced by caring.
At the center of this figure is all of you. And it's your personal commitment. It's how you do your daily jobs. And it's having patient safety on the top of your mind in everything you do with that job.
It's in our hands. We are the key to our success. Our work as an individual, our work as a team member within our departments, and our work as a team member across our departments.
Christopher, what's a good day for you?
A good day for me would be when I am up walking, being a normal kid. Back when I was 2.5, still perfectly fine. I'm like, the future to me will be, I will probably become an engineer just like my grandpa, because he was just like a hero back then. Now, since the road has changed, now I'm looking at bigger goals than what I thought I would ever have. And all these doctors, nurses, and my friends have helped me make those goals.
And that's where the Footprints department comes into play very much. Their main goal is making quality of life better, not putting those restrictions on the children, showing them that we can make this happen. They're focusing on those kids and making life as normal as possible.
Every day.
There really is no tomorrow, because even though my calendar says differently and it's booked out for a while, but there really is, today is the most important day, so let's make the most of today.